afternoon. Today I want to talk about the DSM-5 diagnostic interview. And the diagnostic interview is a screening of questions for each of the DSM-5 categories of mental disorders. If a person answers affirmatively to one of these questions, what do you do? Well, in the screening of the questions, there are avenues of the psychiatric disorders. And a good interviewer skillfully travels these avenues with a patient and a client, and when possible, reaches a specific and accurate diagnosis along the way. Um, each category of the DSM-5 diagnosis presented, whether it's bipolar disorder or elimination disorders, um, each section begins with one or more screening questions when you look through the DSM. And so after the screening questions, there are follow-up questions. And each of these follow-up questions include a measure of impairment or a measure of time. These measurements are required part of the subsequent diagnostic criteria. So by putting follow-up questions before the additional symptom questions in the diagnostic criteria, you're attempting to make the interview more efficient and precise while reserving full diagnosis of a mental disorder for a person who was impaired by his experiences. The screening and follow-up questions are followed by the diagnostic criteria when the diagnostic criteria are to be elicited by the interviewer. I say the prompts for the relevant symptoms are structured within these questions so that an effective answer meets the criteria of the symptom. Okay. So there's a minimum number of symptoms necessary to reach each particular diagnosis, and you can find that in the DSM. So when you're talking about the neurodevelopmental disorders, and that's the first one I want to look at, and then you look in the DSM-5, the neurodevelopmental disorders are between pages of 31 and 86. And so the screening question for a person or caregiver of some of these, do you have any behavior or learning problems during your early childhood? When you started school, did you have trouble relating socially or keeping up academically with your classmates because of behavioral or learning problems? And if yes, then you ask these questions. Do you have any concentrating or struggle with being impulsive or hyperactive? Do you have difficulty communicating with other people or in social interactions? Are there specific bothersome behaviors that you do frequently and find hard to control? And finally, do you struggle to learn more than your classmates do? Now, if these deficits in intellectual functioning or specific academic skills um, predominate, proceed to intellectual disability, intellectual developmental disorders criteria, if the deficits in social interactions or impairing motor behaviorals proceed to autism spectrum disorder criteria, if inattention, hyperactivity, or impulsivity predominate, proceed to attention deficit hyperactive disorder criteria. Okay, so those are the things that you would do when you're looking at the diagnostic interview. Okay, some of the things with the intellectual disability or intellectual development disorder, right? Inclusion. Development disability inclusion requires intellectual defects beginning during the developmental period that impair adaptive functioning as manifested by both of the following symptoms: deficit in intellectual functioning, such as reasoning, problem solving, planning, abstract thinking, judgment, academic learning, and experiential learning, must be confirmed by both clinician and a clinical assessment and individualized and standardized intelligence testing. The second criteria is impaired adaptive functioning, normalized for developmental and social cultural standards, which restricts participation and performance for one to more aspects of daily life activities. The limits results in the need for ongoing support at school, at work, or for independent life. The modifiers, the severity are mild, moderate, severe, and profound. Okay, so that's when you're dealing with um, intellectual disabilities or intellectual developmental disorder. So the alternatives that goes with that diagnosis, if a person younger than age 5 fails to meet expected developmental milestones in several areas of intellectual functioning and is unable to undergo systemic assessments of intellectual functioning, consider global developmental delay. Okay. So there's always an alternative. So now what we need to do is we look at some of the things that included in autism spectrum disorder. And inclusion requires persistent deficits in social communication and social interaction across multiple contexts that are present in the early developmental period by that may be but may not be manifested until social demands exceed limited capacities, and that causes clinically significant impairment in functioning. The disorder is marked by, for example, all of the following persistent deficiencies in social communication and interaction, right? And so some of the deficiencies is deficiency in social emotional deficit in social emotional. When you meet someone, how do you introduce yourself? Do you find it hard to greet another person? Do you find it hard to share your interests, thoughts, and feelings, such as with other people? Do you dislike to hear about what other people are interested in or how they feel? Deficit in nonverbal communication. These are usually observed by the interviewers and range from poorly integrated verbal and nonverbal communications through abnormalities in eye contact and body language, or deficit in understanding and use of nonverbal communication to total lack of facial expression or gestures. In the early DSMs, usually first evident in infancy, childhood, or adolescence was the disorder. Now the focus is on the individual during the formative period when the development of the nervous system takes place, and that's logically enough neurodevelopmental. Many of the disorders considered in the neurodevelopmental disorders can be first encountered in childhood or young adolescence. Anorexia, schizophrenia are two examples that usually come to mind. Conversely, many of the disorders in this chapter can continue to cause problems for years after childhood and into adulthood, but only a few commonly of these disorders clinicians who treat adults. Okay, so some of the things that you got to look for when you're dealing with neurodevelopmental disorders are autism and intellectual disabilities. That include intellectual disability, borderline intellectual functioning, autism spectrum disorder, global developmental delay, unspecified intellectual disability, right? You get into the communication and learning disabilities. You got the language disability, social communication disorder, speech and sound disorder, childhood onset fluency disorder or stuttering, selective mutism, specific learning disorders, academic or educational problems, unspecified communication disorders. You got the tic and motor disorders, which includes developmental coordination disorder, stereotypical movement disorder, Tourette disorders. Interesting thing about the Tourette disorder, there was this basketball player. Mom, he went to LSU. First, his name was Chris Jackson. Then he converted to Islam and changed his name to Mahmoud Abdul Rauf. And he has Tourette syndrome, or Tourette disorder. Um, so those are some of the key things. Another thing you'll find in this this section is attention deficit and disruptive behavior disorders. Of course, attention deficit hyperactive disorder, ADHD, oppositional defiant disorders, conduct disorders, disorders of eating, sleeping, and elimination. Um, Other disorders or conditions that begin in developmental period, like parent-child relationship, relational problems, sibling relational problems, problems related to abuse or neglect, disruptive mood dysregulation disorder, separation anxiety disorder, post-traumatic stress disorder in preschool children, gender dysphoria in children, um, factitious disorder imposed on another. Um, and that's usually when a caregiver induced symptoms in someone else, usually a child with no intention of material gain. Uh, Other specified or neurodevelopmental disorders. So those are the disorders you'll find in the neurodevelopmental disorder section. So then, like what you got to do next is when you get to DSM-5. What you do is when you get to DSM-5, you'll go through the different criteria. So the DSM-5, which this is very, very important because of the fact that we're looking at things that the criteria. What are the criteria for these different disorders? So when you start off with neurodevelopmental, you'll open it up, and the first page on page 33, it'll talk about intellectual disabilities and the diagnostic criteria. So that intellectual disability is a disorder with onset during the developmental period that includes both intellectual and adaptive functioning deficits in conceptual, social, and practical domains. The following three criteria must be met, right? So all three of the criteria, A, B, and C, must be met before the person can be diagnosed with this, okay? And then, of course, with your F codes, you have whether the person should be as mild, moderate, severe, or profound. So that's how you usually operate some of the functioning with the DSM. So when we're in class, we'll talk a little bit more about, the dynamics of actually operating. The interesting thing with the DSM-5, what DSM-5 says that there have been 5 major editions of the DSM, the Diagnostic and Statistical Manual of Mental Disorders. The DSM-4 had the multi-axle system. And so the interesting thing with the multi-axis system was that you do axis 1, 2, 3, 4, and 5. What you do is you put a, a diagnosis on each of the axes, and each axis was specific for a particular type of diagnosis, whether it was general functioning, whether it was medical, whether it was personalities. Each axis had a specific function. Well, that was eliminated when the DSM-5 came along, right? So, and one of the reasons it was eliminated was because they didn't want to be viewed that there was a hierarchy as far as diagnosing um, issues with a person. They didn't want it to be a hierarchy. They wanted everything to be on the same plane, the same level, and be looked at as the same seriousness. Okay, so that's some of the things that you got to look at. So, um, that's my brief talk about neurodevelopmental disorders. And so we'll do a part 2 real soon so you can have that in hand. Okay. So I will talk to you all later.